Sure. I think what I'll try and do is give a more concrete idea of how we envision this transformation fund being used, and perhaps can comment also about the movement to an outcomes-based system and how of payments overall as the second phase and how that might work. So as Gail mentioned, we have proposed an operation fund as one pool of money that would support ongoing residency slots where they're now allocated, and a transformation fund. The transformation fund would have a few different purposes. One is new payment models to develop the methodology for a performance-based system. And we had some ideas of pilots or demonstration projects that might be done, because we didn't feel that our committee, or for that matter any committee, could just dream up a new methodology and have a high level of confidence that it would work. We need to get this right. So we need to test these out and be able to move forward with some assurance that we're going in the right direction. So for instance, we could try having a variable per resident amount according to different specialties' level of need. That might be something to try. We could have vouchers that have the support for graduate medical education directed at the individuals entering graduate medical education, and then they take that with them to their selected training sites. We could have institutions or specialty groups within institutions decide that they're not going to accept federal funding for GME and instead going to bill for the services provided by their trainees. We could have demonstration projects that relate to how to attract practitioners to underserved areas. That's what we could do to think about spending the transformation fund dollars on pilots. We also need to spend some of the transformation fund dollars in figuring out how to educate in a more cost-effective way and in a way that will achieve quality practice from the graduates of the programs. Many ideas have been raised but not pursued. The Macy conferences that George mentioned included the idea of competency-based education rather than time-based graduation from programs. A lot of what ACGME is doing resonated strongly with the committee's discussions, and that might be something to pilot with transformation funds. So hopefully that gives you some idea of how this new pot of money, which is still being spent on GME, might be used to actually enhance GME. I'll stop there, and then maybe we can get back to the other things later.
Paul?